So hey everyone, I'm Austin. I'll be presenting the paper Intra-class Contrastive Learning Improves Computer-Aided Diagnosis of Breast Cancer in Mammography. So what's the motivation surrounding this paper, and what makes mammography so important? Well, mammography is the most common and cost-effective method for early detection of breast cancer, the second most common cancer in women worldwide. The authors noted three main motivations for their research. To obviously improve the ability of AI models to assist in detection of cancerous cells in breasts, to reduce annotation dependencies. There's a large barrier to obtain the data, such as patient age and breast density and lesion types, often hidden behind privacy restrictions or barrier behind privacy restrictions or annotation costs in general. And of course, to improve the model's self-supervision. So let's start with some background. As a quick background, there are many other attempts at solving this particular issues, starting back in 2021 with Yoon. The title of that paper was Deep Learning-Based AI for Mammography. They discussed algorithms that can be applied to other mammography interpretations, as well as current challenges in its implementation in world practice. This paper acted as a knowledge hub for within the next few years. But from there, there were some other not dependent but relevant papers that were connected to which, starting in 2020 with Salim. They had external 3 commercial AI algorithms that performed independent assessments on screening mammograms. Yan et al. In 2020 that performed a YOLO method, you only look once, and then the Lauritsen in 2022, the AI-based mammography screening protocol for breast cancer, which utilized a commercially available AI model named Transpera, designed to work with digital mammogram images and produce a score that indicates the likelihood of cancer being present in that image. I believe their model produced reduced workloads for most radiologists, I think by 63%. So let's talk about some methods. The author's framework aims to exploit the four-view nature of mammograms, the RCC, LCC, RMLO, and LMLO, to learn the intra-class variations without using the extra labels we talked about. So as we can see here are the 4 image types: the left and right craniocaudal view, which is the breast tissue from the top down, and the left-right mediolateral oblique view, which is the image taken with the breast compressed from the side at an oblique angle. So starting with this input image, we feed this to a fully convolutional encoder, which is pre-trained and has additional convolutional layers built inside to further extract those feature maps. And I applied it to global average pooling, which reduces the feature map to a 1D vector to produce the feature vector that is passed to the class head for distinguishing cancer from non-cancer, and the 2 projection heads to produce the embeddings vectors that are used for contrastive learning. And this is where we segment our images based on the similarity between features extracted from the different regions of the input image. So the goal of this lesion contrastive loss is to improve the discrimination of the lesions from the surrounding normal tissue. This is done by encouraging the model to learn representations that are sensitive to the difference between the two. In other words, grouping similar and removing dissimilar models. Removing dissimilar features and pairing similar features. This is done by calculating distances between the two. And so the closer the distance, the better off we want to keep. And the further away the distance, we want to push further away. When this is known as lesion contrastive loss, whereas in normal contrastive loss, they utilize tissue symmetry, both breasts of normal patient diversity, normal breasts from different patients as well. So let's move on to the implemented function. So one way to implement this contrastive loss is by utilizing the approach is by utilizing an input of 3 images. They call this the triplet function. This function was actually introduced in another paper in 2015 by Schroff et al. For the FaceNet on facial recognition paper. This function can be described more as follows. It computes the maximum distance of the difference between the anchor and the positive image. So anchor A, positive image P, and the negative image N, and the anchor A again, based on the minus the margin. So starting here at I over size T, represents the total number of triplets being trained, DAP, for the Euclidean distance between the anchor A and P, and as well as the A and N negative image, and as well as the margin. Authors collected about over 88,000 mammograms from about 10 other institutions between two countries, all with positive, benign, and normal cases embedded, around 11,000 positive, 36 benign, and 40 normal. But their validation set and test set were split between, or 50-50 split between all a random set of positive, benign, and normal. They evaluated these models using three metrics: the AU-ROC and DeLong. I'm sorry, two metrics: AU-ROC and DeLong. Specifically set at fixed sensitivities 0.8, as well as the DeLong test was used to generate those confidence intervals and p-values when comparing the two methods. So the authors proposed loss functions by adding them to three different settings. First, a basic baseline with binary classification between cancer and non-cancer, as well as a multitask learning approach that trains with BI-RADS, which is the breast imaging reporting and data system categories, as an additional task, and as well as a multitask learning framework that uses the extra information like BI-RADS categories, such as breast density, radiological subtypes, and etc. This figure shows on the right hand side here that the model fit is a lot more. The model is more fit to this shape, and usually improves. And this has shown that it's improved model performance. The research team's method improves the performance of baseline multitask approaches even more, suggesting that their lesion contrast loss and normal contrast loss encourages models to learn different characteristics captured by the supervised multitask learning. Additionally, when compared to models in recent papers, like Schroff in 2015, who introduced that triplet function, they created a model called MAMINET, I think that's how it's pronounced, which is a funny name, which is a mammographic multi-view mass identification network with tri-view mass identification, which is fairly similar to what we're discussing today. But when compared and appended with the new implementation of our paper here today, it shows that there was actually an improvement from 0.867 here to 0.880. But even more so on the second paper, Kiono in 2019, which implemented another version of the CNN, showed an even more marginal improvement. So in these studies, to maintain a balanced data set, an equal number of lesion and non-lesion cases are sampled for each batch. The authors found that sampling triplets in sort of a naive way can be problematic, because the negative pairs may be too distant from the anchor to be for the image to be really even effective. So in order to mitigate this, they implemented a technique called hard negative mining, HNM, as seen in this column. And so what this does is that they use the 5 closest negative image to the anchor image based on the distance. So this essentially just speeds up the training and improves the final performance of the model. So being very biased in the choices that they use for the negative choices for the negative image. So in their ablation study, they had a specific type of contrast loss used. Excuse me. In their ablation study, they performed and analyzed the effectiveness of each of these. So the lesion contrast loss, the normal, and the new technique hard negative. And what we see here is that the implementation of all three based on the triplet gives the overall best performance compared to just one or the other, or the pair of just LCL and NCL. Again, this goes back to the Kiono paper that they showed based testing on. What's interesting is that their method works well with different types of contrast losses, such as the triplet loss, and as well as pairwise loss seen down here below, which is from the paper called Hadsdell in 2006, which proposed a dimensionality reduction by learning an invariant mapping, sort of DRLIM acronym, whose learning relies solely on neighborhood relationships, which is tangentially similar to what we're discussing here today, where we want to group together like variables and remove dissimilar variables, as well as the info NCE, which is from a paper title, or I'm sorry, not paper title, but from Van der Orde in 2018. And that predicts whether two different views of the same input are from the same distribution, sort of inching closer as time goes on to where we are today with similar versus dissimilar proportions. So among these three, triplet loss gives the absolute best results. And they also performed a feature representation test, which they tested by learning and training the linear classifiers on top of the features for the two masks. So predicting lesion type and breast density. And the results in here show that the method outperformed the baseline significantly for both tasks with very low p-values, showing that the learned representations effectively capture these intra-class variations among normal and breast lesions. And lastly, they performed a subgroup analysis. This was a group biopsy given proven benign lesions and a group of contralateral breasts, which is the opposite side to the breast diagnosed with malignancy. Hopefully that makes sense coming across. They found that their proposed loss functions reduced the false positive rate for both subgroups. This demonstrates that learning the intra-class variation helps the model handle ambiguous examples near the class boundaries, which again shows significant improvement in reducing the false positive rate. So leading to the conclusion. So unlike previous multitask learning approaches, the researchers' method improved cancer detection performance without additional annotations. Experimental results further demonstrated that the proposed losses produce discriminative intra-class features and reduced false positive rates in challenging cases. So the conclusion of all this, their framework learns auxiliary information without supervision through experiments with over 88,000 types of exams. Variations of exams show that their approaches improve the model performance without needing those labels compared to other multitask learnings. And my final thoughts are that the team provided sufficient information and justification to show that they've added value from the empirical improvements that they've showed, but the results are marginal compared to any novel proposal in this field. And that is all I have.